Hi everybody, I'm Dr. Richard Stevenson and I'm the Director of Stevenson Dental Solutions in San Dimas, California. And today we're going to conclude our series on anterior ceramic veneers. And our focus will be on provisionalization. And I think that provisionalization of veneers is sometimes one of the most challenging parts of veneers. I have three techniques we're going to discuss. The first technique is called sash. What the sash technique is, it's a technique where you want to provisionalize maybe just one veneer. And sometimes this is much easier to do with a little guided stent like this. And you can then fabricate the facial remaining areas with direct composite, much like the RSVP, but just a single tooth style. The other technique we're going to talk about is the RSVP, and I have a patient case I'd like to share with you. This is just a case of 6 veneers were prepared on this patient. They were spot etched, and using the RSVP technique, we build up the lower portion of the veneers, the incisal 2/3, and then we take care of the gingival aspect with direct composite as well. And this is the RSVP finished. Then finally lab processed, which is the gourmet choice for patients that are VIPs, that are going to be in a movie or on TV or a wedding or something really important where they have to have the veneers provisionalized in a beautiful manner. So you have to take a final impression, have your technician build them up with composite in the laboratory, utilizing all kinds of translucencies and effects and things like that, and then provide these for you as a single piece, which you then would spot etch, use some of your adhesive material, and then deliver these in time for the special event. But let's get started with the first most common technique, which is the rapid simplified veneer provisional technique. And we have 2 putty stents here, one on the left and one on the right. This one here is just the putty itself. It happens to be polyvinyl, which is an addition silicone, not the condensation type, so it's very accurate. But I think you can make it even more accurate by adding a wash in the stent again on the diagnostic wax up, so that you get really good adaptation in the areas of the incisal edge and the lingual surfaces. And then this will provide with the best possible accuracy of the RSVP and make the fabrication of the provisional a little bit easier. The veneers have been prepped from the parts 2, 3, 4, and 5. We have a facial veneer, an incisal butt, a lingual wrap, and a super veneer. And you can go ahead and just try this on the diagnostic wax up, and you can make a modification of the stent so that it'll be easier to make a provisional that does not invade the gingival areas. The last thing you want to do is have excess provisional material in the gingival sulcus that you have to grind out, or maybe a gingival embrasure that is closed and does not allow the patient access during the temporization or provisionalization period. So I'm just cutting a window which is approximately 1 millimeter incisal to the interproximal papilla. We can use a burr like this, which is a coarse acrylic burr, to refine that important measurement of having this border 1 millimeter incisal to the interproximal gingiva. We're now ready to etch the teeth. We're going to spot etch, and the reason why we're spot etching is because we want to be able to retrieve this provisional easily, but at the same time we want it to stay put while it's being provisionalized. So making about a 2 millimeter little circle in the middle of each tooth, so it's always in the same place. That way you know where to remove the bonded material with a disc or something and not have to use an aggressive technique to remove the material. We're then going to add adhesive. And just a little dot on each spot etched area is all you really need. And then at this point, we're ready to go ahead and light-cure this and prepare the stent with the bisacrylic material. So we're now ready to use the temporary material, and I like Visalis. This is made by Kettenbach, and it's bisphenol free, and it comes in various shades coming across the ticker there. And it's not a bisacrylic, it's a little bit different. It's completely repairable with composites like bisacryls, but it's quite different. We're going to fill the stent, making sure to trap no bubbles along those incisal edges. That's really important. That's really the most important part. and then we're going to seat the stent completely, and we're going to keep our eye on this material. And we're going to go ahead and check it when it's at the doughy stage. We're just going to take an IPC and run that IPC right along the border of the stent and the material that's oozing out, and just cleave that off. And this will provide us with a zone which is free of any temporary material, allowing us access to that zone that is 1 millimeter incisal to the papilla. So wait for it to be fully set, and when removing it, you can see how beautiful it is. And there's not a lot of excess because we used a very accurate stent. You notice these gingival areas are all like little class 5 restorations, and you can use any composite you like. I think it's probably easy to use a hybrid composite because you can control it really well, but today I'm going to use a flowable because a flowable is another option. Check for any problems where you have voids too, because it's a good time to fill the voids with your flowable composite at this time. We're going to use this A2 Ultraflow Herculite composite, which is a nano-hybrid flowable. So just start by carefully placing the flowable composite along the void of the gingival of each tooth, keeping in mind the reason for doing it this way is to avoid having excess composite in the gingival embrasures or going subgingival, which would make for very difficult cleanup without maybe nicking a margin, which you've already taken an impression for. Remember, this is a technique we're doing after the final impressions are completed, and we don't want to have any composite flash in those interproximal areas. This is very different than a mock-up. A mock-up is much easier. A mock-up we can make with a full coverage stent and just go ahead and add all the material because a little bit of excess composite won't be a problem so much in that particular case. You want to spend a little bit of time just shaping it. If you have any voids in the previous layer, you want to go ahead and fix those too. Sometimes that happens. What I'm using here is the IPC type instrument that comes in the Composculpt kit, which you can get from my website at a great discount compared to most supply houses. And anyway, I'm just carefully manipulating the composite material and placing it in the voids along those gingival areas. Once you're satisfied that all areas are covered, go ahead and light cure each tooth for the appropriate amount of time, and then we can start the finishing and polishing. So let's speed this up and take us through the finishing and polishing steps, which I've shown in previous videos. For example, the Class 4 composite and the composite onlay videos that I've made previously. This is the diacomp system. We're using the green followed by the gray. We're using the green right here. This is the first step. This is called the feather light. It's a wonderful finishing abrasive. And now we're moving on to the gray. And I always make sure that I use a little bit of water while I'm doing this. And the assistant would be typically spraying a little bit of water and air simultaneously while we're going through the procedure to keep the excess material from accumulating in little voids that might have occurred when you made the provisional, and to just keep the teeth nice and cool during this process. But this works really, really, really well. Always spinning this in directions so that the flutes on the end of this feather light are not going backwards, and it's pretty obvious when you pick up the instrument how to do that. And we're not going to spend a lot of time finishing and polishing because the material is so nice when it's coming out of the stent. And when it comes to hygiene, I like to use something called a Pixter. This is made by Erskine, and you can get these on Amazon. I like to get the sample pack and then find out which ones you really like, but the gray one is my favorite, size 0. And these little guys are just great because they're so small and they're so flexible. Your patients will really like these. They can keep them in their wallet or their purse or whatever. And this little tip can be bent. Let's take a closer look at it. It's very gentle to the tissue, and it can be inserted in the smallest embrasure areas. Now everybody can imagine that it could go there, but what about this small embrasure? Any chance of making it through there? Absolutely. It has no problem negotiating the tightest embrasures, and even in the healthiest mouths where you have very little space, this little Pixter 0 works out great. There's also a 00 available if you want to get a really small one. Tissue health, of course, is essential for provisionalization. That's one of the reasons why we're doing the technique here. Another thing I'd like to share with you is this Contact EZ system. And this system is used for interproximal contact adjustments and for removing excess composite. It can be used also for IPR for your clear aligners and things like that. But let's go ahead and use this little orange one here. And the orange one I kind of think of as like an emergency cone on the highway. In other words, you use this in cases of emergency. It's a more robust than the thinner ones, and it's got diamond particles on one side and it's safe on the other. So you can saw between the teeth and you can see it scraping away a little bit of composite, because we know we haven't really been able to get access to finishing that area. And here we're doing it on the areas that are going to be intended for flossing. Obviously, this is not going to be used to separate the other veneers from each other, but it could be if you so desired. I like to keep them all connected for better strength. Look at the dental floss, how it just slides through here, but you have a good snap as you pull out with catching no excess flash that could lead to gingival inflammation, which would severely impact our cementation procedures. I plan on doing a video as sort of an addendum on cementation of veneers and then maybe occlusal adjustment, because that's a big topic, and I think a lot of us need to get a little bit more information on how to deal with occlusion with veneers. It's a very complex topic, so that's coming later. So let's talk about the last technique called SASH, the splint-assisted sculpting by hand method. That's just my terminology. People just call this hand sculpting or whatever, but this would be great for a single veneer, those cases where you have adequate contour and shape and length, but you have something like recurrent caries and you want to replace a single veneer. So we go ahead and we make this mini stent that it's made just over a few teeth, and we're using this to capture the incisal edge of the tooth we're going to prepare. So here's the preparation, which is an incisal butt veneer, as we've shown in previous videos, and now we need to provisionalize this. And so this technique works fantastic for this particular situation. We all would agree, I think, that reproducing that incisal edge is the most challenging part of a direct composite. So we can utilize this technique a little bit like the Class 4 matrix technique, but a little bit different because it extends around more onto the facial. We're going to just go ahead and spot etch it like we always would, and then we're going to rinse this off and apply our adhesive. If your adhesive is too thickly applied or too liberal with the application, then we can go ahead and use a dry microbrush and just pick up a little bit of the excess and just leave it a little bit more thin like this. And then of course we're going to light cure this. So at this point, let's go ahead and take this little mini stent and let's apply our composite into the incisal area. Now this is the most difficult area for us to reproduce properly, and you may want to use a more translucent material in this case if you'd like to. You can make this very sophisticated by adding different layers inside of here if you so chose. I'm just using the single shade of composite for this particular case. And we want to just fill that just incisal edge area. At this point, it's nice to take a little bit of the adhesive you're using and just add it to the surface so that the material just has a little bit better flow. You could use a flowable composite for this, or you could use Bisco's modeling resin, which is made specifically for this particular purpose. So we just go ahead and insert this on the tooth, hold it in position, and because there was a little gap there and there's plenty of tooth available for us, we can light cure through the tooth and through the exposed composite. So when we remove this stent, we have the incisal edge reasonably well duplicated, and then we can just use whatever composite we like to replicate the remaining portion of this particular tooth. I know some of you are thinking, hey doc, why not just use the RSVP technique? Well, I'm just going to make the entire tooth out of composite, and the RSVP technique wouldn't work with composite because you need to be able to gain access to light curing that incisal area. The RSVP material covers over quite a bit of that facial surface. So we're just going to go ahead and shape this by hand, and it's pretty easy. I think that most of you would be pretty comfortable just on a single facial like that. Remove any little excess that you might have left behind. I get a lot of these little fibers impregnated in my composites in my laboratory. It's kind of frustrating. But anyway, we're going to go ahead and finish this with finishing diamonds. I'm using a 135F014. This is made by Brasseler. And you can just remove Any little defects, at this point, if you have any little white spots or voids, those can be filled with flowable or a hybrid composite of your choice. This technique does require a little bit of finessing, but notice how there's nothing at the gingival, nor do you want that burr spinning at the gingival because your margin is already finished and you've already taken your final impression. Utilizing a number 11 or number 12 scalpel, we can twist it. See how I'm twisting it towards the other tooth? Remove any excess. So let's go ahead and start polishing. We're going to use the same polishing system we've used in the earlier part of the video. Plenty of water, utilizing the feather lights. And we don't want this veneer bonded to the adjacent teeth. We want to give the patient the ability to floss, and we're going to go ahead and make sure that the floss passes easily through that particular area. It's a pretty quick technique. It only takes probably 5 minutes or so to do it, and I think the patient can leave your office feeling pretty good about their provisional, and you're going to be pretty convinced that this is not going to fall off so easily. So not perfect, but definitely a decent provisional. The thing I really don't like is the fact that all these little fibers are floating around in my lab, and they kind of cause this stuff that doesn't really happen in my clinical practice. But I think it's a reasonable job, and this technique can even be used for your class 4 composites. Maybe if you're doing that on a Typodont, it might work out. You know, if you're interested in learning ceramic veneers at a deeper level, you may consider taking a course from us. I would love to share this with my YouTube subs. You guys have been so great and you've been so loyal, and I really appreciate it. We have discounted this course from its normal fee, and I think it's a great deal. It's CERP approved, so if you're from a foreign country and you come in to California, you can make a great vacation and you can get units of credit that would be valid in your own country. I think that last year we took the course, we had people from 3 different countries, and it was a great course, a very international group, and we all learned quite a bit, even if you only have little experience or you have lots of experience. If you're a new dentist, in other words, if you've graduated after 2012, just use the coupon DENTIST6 with a capital D there, and you get another $300 discount, making this hopefully more affordable for you young practitioners out there, or even dental students that are looking for a cool course. As always, it's been a pleasure spending some time with you all. I hope this series was beneficial. Wishing you the very best.